Great to have you with us on The Full View. This Youth Day, we're focusing on the health and well-being of young people in South Africa. Adolescents between the ages of 10 and 19 face particular challenges. So we're talking about mental health issues, sexual issues, teenage pregnancies. A new report by Stats South Africa says the leading causes of death in this age group is external causes of morbidity. So that means things like accidents or assault, followed by certain infectious diseases. Well, to discuss, we're joined now by the CEO of the LoveLife Trust, Dr. Linda Ncube-Nkomo. Doctor, thank you for being with us. There are so many issues. LoveLife, starting with the focus on AIDS, you've got a broader focus. There are so many issues. What's playing on your mind when you think about the health of young people this Youth Day? All right, we've lost the doctor. As soon as we get her back, we'll talk about this. And of course, teenage pregnancy is one of the major issues. Just to give you some of the stats that I'd like to talk with her about, 100,000 live births were recorded amongst teenagers in 2019 in this country. That's 100,000. That, of course, excludes abortions and abandonment. We'll talk about access to health services for teenagers who are pregnant and having difficulty and feeling the shame of that. And then, of course, a myriad of health issues set back by COVID-19 and what happened. Let's see if we are joined by the doctor now, Linda Ncube-Nkomo. Doctor, I was asking, what is top of mind for you when it comes to health and young people this Youth Day?
What's top of mind? Good evening, first of all, Francis, and thank you for inviting me to have a chat with you about the health of young people. Definitely top of mind is young people being able to access health services and being treated with dignity and respect when they get to those places. It's them being able to get information that enables them to make healthy, informed choices around their health, and being able to get that information during their adolescent years, because the behaviors and the attitudes that they develop during those years tend to follow them into adulthood. So it's about access to information, access to services, and being able to make informed choices so that we balance prevention and treatment.
In that regard, can you comment on something that we've heard on this show before, that young people with HIV or AIDS try and go and get their ARVs, and sometimes they are treated with condescension. They are shouted at by the nurses, they are lectured by healthcare providers, and that makes them reluctant to go back. Of course, that's a sweeping statement, and we can't put everybody in the same boat, but is that a problem?
It's not only young people. That feedback we get not only from young people wanting to get treatment for HIV/AIDS, but young people wanting to access treatment for anything related to their sexual and reproductive rights and health. And as a result, we work very closely with the Department of Health in ensuring that facilities are adolescent and youth-friendly, and young people can be able to go to what we term youth zones, where they can be served by healthcare providers that have been trained to deal with young people with dignity and respect.
Before we reconnected with you, I was looking at teenage pregnancy. So the last stats we have is more than 100,000 live births among adolescents, and that was in 2019. So that figure would then exclude abortions and young people who are just so desperate that they abandon their babies. Am I correct?
Indeed. And you know, we need to start going beyond the numbers of adolescents giving birth and start holding the relevant departments accountable. When last did you hear that a person who impregnated a child was prosecuted and thrown into jail for that? Or that an adult who was complicit, a family member who was complicit, was prosecuted and thrown into jail for that. Because it's all very well to have the numbers, but if we're not being intentional about stopping that stem, we will forever be talking about the numbers of young people that have had live births, and we're actually talking about children who have been abused, fallen pregnant, and no adult has intervened.
And we have to emphasize again that at a certain age, it's always statutory rape, so the adult should be prosecuted.
Absolutely, and hence I'm saying that we now need to be going to the Department of Justice and saying, Minister, where are we with the prosecution of the 600 people that raped children in Gauteng, 2020, 2021? Otherwise, we'll constantly have the numbers, and then what? So what? That so what is the important thing that we need to be driving around young children and teenagers falling pregnant.
The teenage girls are the ones left with the problem then. You were talking about access to health services. What are their legal rights in terms of abortion, in terms of adoption, in terms of still going to school? And what is de facto happening when they try and access those rights?
So the rights are that they have a right to be given the necessary services when they go, whether it is health services or being able to continue to go to school. But what we find is that when they do go to try and access health services, whether it is contraceptives or as a teenager who is pregnant, they are met with judgmental attitudes. And the judgmental attitudes don't start with the nurse or the person actually in the facility that's attending to them. We've had young people tell us that the security guard at the gate, to the facility will start to harass them and mock them around being pregnant and being a teenager. So we've got a situation whereby when we're talking about adolescent and youth health, we've got to realize that it is the legal right to get the health services as much as it is the legal right that a pregnant learner should not be kicked out of school and should continue to go to school. But we continue to have those judgmental attitudes, and I think we just need to look at how else can we entrench the understanding that a young person coming to a facility that is youth-friendly is not special treatment, because that's some of the feedback we get. Health workers saying, why are young people being given special treatment? They're not. They're being given access to facilities in a youth-friendly manner that makes them want to come back and access those services.
Well, let's end it there. How do we change attitudes? I think at the heart of all of this is education for adults and healthcare workers and also young people. And LoveLife has been involved in that for a long time around sexually transmitted diseases, HIV, teenage pregnancy. How do things change, and what's been the trend over the years that those educational efforts have been ongoing?
I think, we're trying to, in some instances, and excuse the term that I'm going to use, trying to teach an old dog new tricks. We need to now start building into the curriculum of nurses, for example, that adolescent and youth health care is a necessity, is a right, and it forms part of the way in which they are taught the nursing profession, they are trained the nursing profession, so that they don't get to my age and then start being told that when a young person comes in to access contraceptives, treat them with dignity, don't be a judgmental mother, but be an affirming professional that's encouraging them to take charge of their sexual health. So we need to now start looking at how do we do differently what we have been doing, such that when my age group is out of the wash, there's a new generation of healthcare workers that from the onset understand the importance of adolescent and youth health and being able to offer those services in a professional and dignified way to the recipient of the services.
All right, we appreciate your time this Youth Day. Thank you very much. That was the CEO of the LoveLife Trust, Dr. Linda Ncube-Nkomo.